Emergency care is when something's life-threatening. So anytime there's anything life-threatening going on, you're not going to be calling an office and waiting for someone to, schedule you an appointment. That's, if you have chest pain, if you can't breathe, if you have a traumatic injury and you need to know whether you've broken something or you might need surgical intervention. Urgent care, the patients that I see often are sick, or they're having trouble controlling their blood sugars or their blood pressures, or something is out of whack. It's a change in general. And it's usually something that can wait 24 to 48 hours, but really shouldn't wait much longer than that. We have urgent care availability every day. We're business hours, so it's 8 in the morning. We start a little bit earlier than a lot of practices until about 5, Monday through Friday. But we can usually accommodate people, often same day, usually within 24 hours. People should call their doctors when they're uncomfortable with something in particular. If they're feeling not themselves, if they want to be seen, they should call. And, I know when I think about it as a physician, I want my patients to call. I don't want to find something out when it's too late. Some of those things may be things that can be managed over the phone, but some of those things may need an appointment. And honestly, if there's something that you're not sure if this is an emergency, having a medical professional to talk to can say, yeah, you should call 911 now, or you should get yourself to the emergency room. To have that extra area of expertise, to have a real person to talk to, as opposed to getting on WebMD and hoping you can figure it out. I think that's why you have a primary care provider. That's why you have somebody who knows you over time. Urgent care is usually an extension of your primary care physician. So if you have a good doctor who knows you well, you have good records on, what your medications are, what your allergies are, what your medical problems are, things that you've tried before. If you have a longitudinal relationship with somebody, and that's all in the computer, waiting for the urgent care provider, you can get much better care. When you're choosing a primary care provider, I think it's important to look at all of the different services that provider can give you. Obviously your goal is to have longitudinal care, somebody who's going to take care of you over time and get to know you well and know your medical problems. But when you get sick, you also need to make sure that there's availability to have you be seen when you need to be seen. I think you get better continuity of care if you get all of your care at Tufts Medical Center rather than trying to have your care in multiple places. And the reason I say that is, as an urgent care provider, I want to be able to see all of your visits, not just the last consultation note. When I'm providing urgent care at Tufts Medical Center for patients who've gotten all of their care here, I can see things that happened 10 years ago. I can see the x-ray. I can easily find blood work that was done a few months ago. I really feel like I have, as the urgent care provider, all of the information at my fingertips rather than having to try to figure out, what things might be important. In some cases, if you have urgent care without a sort of dedicated urgent care provider, you have to explain yourself all over again. And one of the nice things about the practice at Tufts Medical Center is we have multiple doctors who are doing just urgent care and have regular schedules. So if you see me on a Thursday and I say, that rash, let's try this. I don't know for sure that it's going to clear it up, but I want to see you next week so I can, do the follow-up and make sure that it's done, that it's better. You can always call to cancel, but I want to be able to see it, especially if it's not better. So having that availability and that opportunity to do a little bit of limited continuity is nice for me.